Hi, my name is Brandon. I am an outpatient coder for Spring Hill Medical Center. Basically, my responsibility as an outpatient coder is to review physician documentation and extract diagnosis and procedure codes from that information so that the hospital can be reimbursed. On a typical day, I usually have a work list waiting for me once I arrive to work. Because I'm an outpatient coder, my work list usually consists of clinical charts, emergency record charts, same-day surgeries, or observations. And what I will do, I will open a chart, which is a patient health record. I look for what the physician has documented for the patient to be either the final diagnosis, which is the reason the patient came to the hospital. I will use our classification systems, which is the ICD-9 diagnosis coding. Encode that into an encoder. And the encoder from there is what the third-party payers and insurance companies use to reimburse the hospitals. And I would do the same thing on the procedure side if a procedure was performed. The classification system for a procedure is the CPT classification system. I will code the procedure that was performed, and the hospital will use that information to be reimbursed by the insurance companies. For example, if a patient comes to the hospital with arm pain and a physician diagnoses the patient with a fractured arm, what I would do is look for the code in the classification system. A code is basically a series of numbers used to diagnose the reason that the patient came into the hospital. A normal work week is 8 hours a day, 40 hours a week. Sometimes we're asked to work overtime based on the workload. I don't see this being as a very stressful job. Our coding team works together to meet monthly and annual goals. That can bring about a little stress, but nothing that I feel is overwhelming. Employers usually require either a 2-year associate's degree or a 4-year bachelor's degree in health information management. The program that you attend, be sure to make sure that it is accredited by either a HEMA or AAPC. Those are the two accrediting programs for the health information management field. I graduated from a 4-year degree university, and some of the courses that I recall were pathophysiology, human anatomy, medical terminology, and coding, of course. If you're really interested in the coding realm, you can also look into the accrediting agencies, HEMA and AAPC, and look at some of the credentials that they have available for coding. Employers really appreciate anyone that is certified in the coding field. The flexibility in this field is definitely a plus. A lot of employers allow coders to somewhat make their own schedule, just as long as you get your required hours by the end of the week. And because this field is in such high demand, there are plenty of opportunities available. I can't really identify with anything that I consider as being a negative. But if you decide to work in this field, be prepared for the constant changes. I feel that this is a field that you can't really master because there's always something that you can learn. Changes happen monthly, yearly, and often. So that's something that you should be prepared for, but I can't really consider that to be a negative. It's really in your own opinion. The best advice that I can give is to be sure to network and get your name out there as much as you can. For example, for anyone that's going to a 4-year university, they'll require internships that you must have to graduate. During those internships, don't be afraid to talk to people and get to know people, because you never know, that might be the person to hire you for your first job.